Hi, all. Brian Taylor here. I'm here to talk to you about my new plural book, Relationship Centered Consultation Skills for Audiologists. The book, like others I've written for plural, aims to be practical, to have a good scientific base, and have several easy to implement strategies for those of you that work in the clinic. For the first 15 or so years of my career, I was in the clinic. I know how challenging and how rewarding it could be. And I hope that my writing reflects that. I talk about scientific basis. The first couple of chapters of my book get at the theory behind patient-centered and what I call relationship-centered care. It looks at some of the psychological models that address the ins and outs of patient-centered or relationship-centered care, like the health belief model, the stages of change model, and several others. That forms kind of the scientific underpinning of what I think you can bring to the table inside your clinic when it comes to relationship-centered communication skills. In addition to that, and kind of the meat of the book, there's a couple of different chapters on how to implement patient-centered or relationship-centered consultation skills in your practice. One entire chapter on in-person relationship-centered communication skills, how to conduct a more patient or relationship-centered needs assessment, a more patient or relationship-centered follow-up in person. And then, of course, because of the pandemic and social distancing guidelines that we're still sort of still following, there's an entire chapter devoted to how you can be more relationship-centric when you're working in remote locations. The patient is at home on their computer, and you are at your office connected to them via Zoom, like we are here. How you can still provide good relationship centered communication even when you're not physically in the same room. And then finally, because all of us want to earn a buck at the end of the day, there's a chapter on how you can utilize patient-centered or relationship-centered tactics in a clinic as a fee-for-service opportunity. So I hope all of you take the time to pick a copy up of Relationship-Centered Consultation Skills for Audiologists, both in-person and remote. And I hope you can find it online. I'm sure you can find it at the Plural website. Thanks for your time, and I hope you're all enjoying this beautiful summer weather.